2 months after the H1N1 or swine flu surfaced in Mexico, Australia has suffered its first swine flu related death, a West Australian man with other serious health conditions. There are more than 44,000 cases worldwide and more than 2,300 in Australia, with Victoria having more than half that total. This week, the federal government moved to a new phase level, downplaying the threat, saying the virus is not as severe as originally thought. Our next guest, Lawrence Gostin, is Professor of Global Health Law at Georgetown University. He's an expert on pandemics and an advisor to the World Health Organisation and the Centres for Disease Control and Prevention. We talked earlier to Lawrence Gostin, who's also a visiting professor at the US Studies Centre at Sydney University. Professor Gostin, thanks very much for joining us on Sunday Agenda.
Pleasure.
Now, you said in an article in the Journal of the American Medical Association that H1N1 could evolve to become something much more powerful and virulent, perhaps more dangerous than the Spanish flu, which killed millions and millions of people in 1918. What are the chances of that?
The chances are very low, thankfully, but one thing that's quite interesting is that the 1918 Spanish flu, which killed over 50 million people in a world that was much smaller than ours, was actually quite benign in its first wave, and then it mutated in its second wave and became much more pathogenic. So that could happen with us. I don't think anybody's anticipating it, but we really have to keep a close watch on it because influenza viruses can very easily mutate. They can become either more benign or they can become more lethal.
What would make them become, or what would make this one potentially become more lethal?
Well, it could mutate because they change and adapt, particularly as they move across the globe and they swap with other viruses, and so it could become more lethal, and it could, for example, become resistant to medications. At the moment, Tamiflu, an antiviral medication, is actually quite good at treating it, but it could become resistant to that medication and become more deadly in the way that it affects individuals. And so we just need to be very careful.
And Tamiflu is really the only line of defence that we have, isn't it?
It is. I mean, we're gearing up for a vaccine, and at the moment the vaccine looks good. But even there, if it mutated, the vaccine could become less or not effective at all.
So is it the case that a lot of people in the community think, well, it wasn't that bad, but is it the case that you're worried that the more it spreads through various communities, it could mutate and become stronger?
It's always a possibility. I mean, at the moment, the public shouldn't be alarmed, but their government and their public health officials at the national, state, and of course international level need to be very careful and watch it. You know, we need to know who gets this infection, whether they get ill, and how ill they get.
But we can't prevent it now, can we?
No, I don't think you can prevent it. Influenza is very transmissible disease through day-to-day contact. You can't contain it. I don't think it can be contained, say, from Victoria to other states in Australia any more than it could be contained from Mexico, the United States, Europe, and the Pacific.
Isn't part of the problem of control that there's no way of forcing countries to kind of come clean on what's happening in their country? Countries aren't required to take any action, and whatever the WHO's alert level is, it's based on a geographic spread rather than the actual threat of the disease.
That's right. You have a couple of problems. I mean, the first one is that this pandemic alert level that we've got really only tells you that it's very widespread. And in other words, this is the first influenza, a novel form of influenza in a long time that's really has pandemic potential. But that doesn't tell you how serious the disease is. And so what I've been recommending to the WHO, and I think the WHO recognizes and will do this, is in the future try to factor in the seriousness of the illness, not just the geographic spread.
But if it was the serious of the illness right at this moment, you would have to say, well, it's not that, it doesn't rate highly on our seriousness level.
That's correct. You would have to say that.
So would that underplay what we should be doing to try and protect ourselves?
Well, no, but I think the problem with saying, "Oh, well, this is a pandemic," is that people get frightened and there's
very nervous.
Too much anxiety. But the other thing is it gives government cover for doing the wrong thing. And so, for example, not Australia, but many parts of the world have literally ignored the WHO. The WHO said no travel restrictions. Well, they put travel restrictions on. They said no commercial restrictions, but there's been trade bans on pork. They said no discrimination, but there's been a lot of discrimination against Mexicans. And so the WHO doesn't have the power, it doesn't have the resources, and the pandemic alert level allows governments to really ignore what WHO is telling them, which is to cautious watchfulness.
Okay, so what would you have countries do? Should they have to be compelled to follow WHO regulations?
Well, I would like to see that, actually. I mean, the international health regulations were adopted throughout the world right in the aftermath of the SARS pandemic, and virtually all countries in the world signed on to that, but they haven't all been following it. And so I do think that the WHO needs more authority, and it also needs more resources.
But Professor, if countries had been forced to follow the regulations this time around, it wouldn't have stopped the spread, would it?
No, it wouldn't have. And in fact, in fairness, I think Mexico did a fairly good job in quickly reporting this. It wasn't the scenario that we had with China and SARS, where they just sat on it for a long time. So all in all, there has been good surveillance, but just not enough capacity.
All right. If we get a stronger version of H1N1, it comes back or it becomes more virulent, the people who've got it now or who've just had it, will they be immune from it?
Well, that's actually a very interesting question. Historically, it turned out that in the Spanish influenza, those who got it in the first wave when it was mild actually did quite better than those who didn't. So in some laughing way, I said, well, if you get it now,
it's better.
It's not necessarily a bad thing. Of course, you shouldn't go out of your way to get it. You should do proper hand washing and hygiene and stay away. So we need to have good protective measures. But yes, it could confer some protection if it came back in a more lethal fashion.
Why is it said that children or younger people we may be hit much more seriously by this illness?
Well, there could be a number of explanations. A lot we don't know. I mean, one of the things is that this flu resembles certain flus well back in our history, and so they
haven't had it in their lifetime.
They haven't had it in their lifetime, so older people may have a form of immunity. The other thing about the Spanish flu, and it seems to be the case with this one, is that it doesn't disproportionately affect the old, but the middle-aged and younger, which is also a worry.
Now, we've had an organised global response. How effective was it, in your view? You're drawing some holes in it.
I mean, I often say I would give us a C or a C plus. I'm an academic, so I grade. But I think that we have operated under the international rule of law, and Mexico did a fairly good job. But I suspect there's a lot of undetected disease. For example, it hasn't hit Africa, but it probably has. In Australia, it's probably much more widespread than we think it is. And on other countries, that's true too. So we need a lot more capacity for surveillance and monitoring of this illness.
All right, a lot of the normal community would say the authorities overreacted this time. Schools have been closed, people have been asked to keep themselves at home, away from work, businesses, the cost hasn't been counted really. Do you think the authorities overreacted, or would you say yes, they have to?
Well, it is a very hard call. If the authorities do very little and it turns out to be a bad disease, then they're accused of not really being there and responsive. If they do too much, they're accused of being overly burdensome of civil liberties and economic liberty. And so I think we just have to, as long as we base it on science, I think clarity and consistency in terms of school closures or other things is the key, and good communication with the public.
In your view, is the world due for a very serious pandemic of flu?
Well, historically, there have been approximately 3 pandemics per century. So we are overdue, but that doesn't mean we'll have it. If we do, we're better prepared than we ever were, because we've got the scientific wherewithal for vaccines and antivirals.
Professor Lawrence Gostin, we'll leave it there. Thanks very much for joining us.
My pleasure. Thank you for having me.